Good morning.
How are you?
Great and yourself?
I'm here.
Good.
We're here. We're here. Oh, we sound good. Okay. Look,
Yeah.
I'm a trouble student. I don't know what. Look, okay. I don't know what we did, but here we go. Okay, I can get this out my ear now. All right. Because that'll drive me crazy hearing the back and forth. All right. All right. Hey, everybody. Hey, hey. Oh, wait. Let me stop this. See, it's always something in it. Okay. We could do that for a little bit. All right. What happened to my one thing? Oh, there we go. Okay. Look, it's coming. It's coming. I see you got on the merch. I see you. I see
Yeah.
you. You better do it. I love it. I love it. All right. Well, it is that 9 o'clock magical hour. Let's see. Let's see. Let's get us started. Welcome, welcome, welcome. Welcome to our Saturday morning tea. We got some tea to talk about today. Where we'll discuss health information, news, education, certification tips, entrepreneurship, just life, all the things, all the things. I'm Clarice Warner. I am the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co host, today's episode is sponsored by the Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right, all right. If you are in Clubhouse, feel free to click the link at the top of the page. For our YouTube and Facebook friends and family, check the video description for the link. Well, joining me today is my illustrious co-host, Mr. Jesse, the registered trademark, the coding nurse. Yes. Sir,
Good morning.
good morning. Introduce yourself and tell the folks all about you.
My name is Jesse. I live in Philadelphia, Pennsylvania. I've been an LPN for 29 years. Actually, I'm going on 30
I
because
know.
my anniversary was the 28th of June when I got my
Right.
license.
All right. All
The
right.
18th of June, I'm sorry, the 18th of June, I got my license
All
in
right.
1993. So
Look at you doing all the things.
And so I transitioned into the world of HIM. Wish I had done it a whole lot sooner, but I transitioned in 2014 and I created my own company, the Coding Nurse LLC, where I help other nurses and other people who have clinical experience transition into the wonderful world of HIM.
Yes, yes. I love it. And how's it all going?
Well, actually, it's going, it's slow as heck now. Look, as the old folks would say, my mother used to have a saying, you can't kill nothing and nothing won't die. But I think it's because of the summer
It's a
and
summer.
people are out. You know,
People,
this is like the first real summer out of lockdown.
it is. It is. You're absolutely correct about that. And when folks are out, they are out.
Oh, I get it. I get it.
Nobody is playing with anybody nowadays. They're out and loving it.
So let me tell you. So before you get it, so I got to do my quick little 10-second rant.
Go ahead.
Because you know how we always talk about, gatekeeping, and we always talk about CDI, and we talk about how nurses have taken it over.
Uh-huh.
So I saw this post on LinkedIn. Somebody had shared a post where this recruiter was looking for 50 remote CDI people,
Okay.
and it said RN required. It's something about strictly required or something. So
Wow.
I'm like, okay. So I'm like, well, I sent my resume and I made it very clear that I'm not applying for this position because you made it very clear that you have to be an RN. So I said, if you have other opportunities where they are more flexible with their licensing, let me know. So the guy calls me the next day. So he goes on about, well, I'm not really sure. I have to wait to hear back from these people if they would accept an LPN. I'm like, what? I'm not even trying for you to even do that. I'm just trying for other opportunities. That's really all. So he says, well, do you have time, to talk? I said, sure. We can do a quick little mini interview. So I explained to him because he wants to know if I know the differences between the MSDRG and APRDRG and all that, blah, blah, blah. He's a recruiter, mind you.
Right. Okay.
So I explained it all to him. And he says, well, the next step is I'm going to send you a skills checklist. And we just want to see what experience you have. And their skills checklist was extensive.
Hmm.
So he said, then after we get your checklist, we'll send you an assessment. So I said, is it a CDI assessment or a coding assessment? So he said CDI. So I said, okay. So I'm looking for it. So the next day I don't get it. So I reach out to him. I'm like, I haven't received the skills checklist. So he sent it right away. So the same day, as a matter of fact, about 20 minutes after he sent it, I filled it out, sent it back. And ain't heard nothing.
Ghost?
Yes.
No, not ghosting.
Hmm.
Oh, oh, that's not. I wonder why they do that.
I don't know.
What is that about? That's crazy.
It is.
Like you, we gonna talk about that too. Before we get started, if you are on Clubhouse and want to join in and add to the conversation, we're monitoring. So please raise your hand. Don't be shy. Come on up to the stage. This is how you learn. Remember, this is also an opportunity to learn the other side of Clubhouse. You may want to start your own. What are these
Rooms.
rooms? Sir, I'm so glad I have my technological person on the line because rooms. And want to know and see what it looks like on the other side. So feel free to raise your hand. We'll let you in. We'll let you talk. Come on. Your opinion
Definitely.
matters, and it is always welcomed here. And then for my Facebook and YouTube friends, you could just get into the chat like Vicky. Thank you, Vicky. Good morning and welcome. Welcome. So let's get into it today. So I think we're going to start with we're gonna save the juicy one for last. We'll start with the United Healthcare thing, and then I found something that's kind of related that I wanted to talk about too.
Okay,
On
let
that,
me pull it up. Because United Healthcare, they're always in something involving some money.
always.
Always.
They stay in the news, don't they?
But I don't know. I mean, when I read the article, I'm like, how do you think you can really get out of that? Like,
It's crazy. So, did you want to take? Did you want to?
no, go ahead.
Really? So, so the
I mean,
so the Supreme Court declined to hear the United Healthcare's appeal of Medicare Advantage overpayment rule. Um, so folks have been saying that Medicare Advantage, their Medicare Advantage plans, the folks been playing games with the plans and just basically assigning all of these codes to be paid more, not taking into account that the patients typically are sicker. I mean, I don't know about you, but the ones that I've actually seen, I haven't seen any gaming, and maybe it's just because I hadn't looked, but I hadn't really seen a lot of gaming. But the government has, they have because they've done some auditing, and United Healthcare was like, hold up, time out. We want to appeal this, and they got caught up in the whole gaming piece. And it's really based on unsupported diagnoses from the beneficiary medical record. So basically, with these Medicare Advantage programs, um, the well, actually, the provider provides the information. So the provider documents the information on the patient, their diagnoses, their particularly their chronic diseases, and annually. And so they make sure that's all we talked about. I think we talked about it last week, actually, or the week
Yeah.
before, where we talked about that you have to annually um, update the list, and then you get the RAF score, and you get all of the things to support the reason that you're providing XYZ services to the patient. And it's a way to kind of understand and know going in, this patient has all of these diseases, they're this sick, this is about how much money we would need to spend um on this patient. And so folks have been on the fence on both sides. One, well, they felt like they were gaming it because they were putting all these additional diagnoses. And it's like, well, no, if they have treated these diagnoses and these people actually have these diagnoses, then um yeah. So they feel like that these health plans are encouraging the providers to code more diagnoses, which of course inflates the charge, or inflates the services, because the sicker the patient, the more time invested, the more um, uh, medical decision making is needed and necessary, which ultimately creates a higher level of service for the providers, primarily for every single visit that they have. And so the Office of Inspector General was like, I don't know, this looks shady. And pretty much just wanted to, they had a report in 2020 and found that Medicare Advantage programs paid $2.6 billion a year for diagnoses unrelated to any clinical services. So they were seeing cases where diagnoses were actually coded and added to patients' RAF score. However, there were they didn't provide any services. The providers didn't see those patients for those diagnoses. And so that was a problem. So again, United Healthcare got caught up in the fray, and they wanted to challenge CMS and the overpayment rule and all of the things. And the U.S. Court of Appeals first said that United Healthcare's argument was without any legal basis, and they sent the case back to their district court for favor in CMS. My thing is, you in DC, CMS is in DC. You ain't got to. No, I'm kidding. You ain't got a chance, really. But it's actually got kicked up to the Supreme Court, and they were like, nope, we're rejecting that appeal. So, did you want to add more to it? I think I gave the Cliff Note version of what happened.
I mean, for our Saturday chat, like that's more than enough information, because it really just comes down to, I had read earlier this week that they're finding that Medicare Advantage is actually costing the government more money than the fee for service, which was supposed to be the opposite.
Correct.
But I think that honestly, because they moved to this risk adjustment model, I think it is easier to catch the fraud, like in this instance. So I can't see them ever going back, because they're getting rid of fee for service is going to be gone in the next 10 years.
Yeah, it's going away.
So but it all ties into, it just all goes back to provider education and coding.
Yep.
Like they're trying to automate coding, and it's like, and until they get some kind of handle on it, you're always going to have this.
Yep.
it's never going to be resolved, because you cannot make providers coders. That's just the bottom line. And in the outpatient, they insist on it.
Mm-hmm.
And then, and I can speak from experience, when it comes to risk adjustment in outpatient, they want doctors to code as many HCCs as they can find. And even if they have to go looking for something. And I just know, like, my last CDI job, I had to fight them. I'm like, just because it's a HCC, it doesn't mean that it applies, because because within certain HCC categories, there's something called trumping. So you can why would you pick a vague category when, if somebody has this condition, it should be monitored, so you should be able to come up with a more definitive diagnosis.
Mm-hmm.
Like, for instance, like immunodeficiency. Immunodeficiency is very broad.
Mm-hmm.
But if somebody has immunodeficiency, what type of immunodeficiency do they have? Like, what kind of blood work do they have? Neutropenia? Do they have pancytopenia? Like, what is going on?
Mm-hmm.
So, but all they know is, well, can we have the providers code that? And then you wonder why you have to pay back all this money.
They wonder why.
Mhm.
They wonder why. So in the similar vein, I found the Department of Justice and Molina Healthcare
Mhm.
agreed to pay $4.5 million to resolve allegations of false claims. Now, the article or the information was interesting, not so much on Molina as a healthcare entity or a healthcare insurer payer, but Molina as a healthcare provider. And I was like, wait a minute, hold on. So y'all all in all the games, right? That it just piqued me, like, wait a minute, they in the game. So not only is Molina Healthcare one of, or Molina is an actual at least here in Ohio. Molina is one that has been on our panel for managed care Medicaid, but I think they just have regular Molina as well. So you in that game, but then they also and I think this was in Massachusetts, they have um, uh, owned ownership in a subsidiary, Pathways of Massachusetts, which deals with um, behavioral health. And I'm like, wait a minute, hold on. is that is that kosher? I'm like, that I was in shock. I couldn't get over. I'm reading through I'm like, whoa. I'm going back. Like, so they paying the money out in state, federal healthcare programs, but then they also getting money because they own and operate a healthcare entity that provides um that are over mental health services. Shut the front door all day. I was like, see, again, it just brings me back to, sometimes we just think a little too small. I just feel like, well, wait a minute. If they can be in all the things, we can be in all the things. What in the
That's right.
world? I'm like, so that was, but this was funny because what had happened was there was a whistleblower. It was a key town. Um, and that means that there's a whistleblower, and it's sealed until it goes through all it has to do. And as a result, that whistleblower, um, well, because they agreed to pay the $4.5 million, that whistleblower will receive some dollars related to
Yeah, 20%.
spilling the tea on what was going on over there. And it wasn't so much that they were uh billing billing or coding incorrectly. They were um not properly licensing and supervising the mental health staff. And so, you have social workers, and then you have other qualified mental health or behavioral health specialists. You have all these entities that are allowed to build in this playground. So you will be amazed that the folks, I could, that's a whole other conversation. I could walk in, I could read a book, I could be like, you know what? I believe this. And as long as I got a licensed independent social worker who will put their license on the line and vouch that I know what I'm talking about, we billing for everything. That's a whole other conversation. But that's how that particular game works over there. So, yeah, they got to pay some money back. But like I said, for me, it was all about well, how y'all in both of the games? Who does that?
You have to be bold because they have to know. Well, their anticipation is that if they get caught, they will have made some money because it takes a long time. And truth be told, most of the big cases, they are whistleblowers.
Oh yeah, the majority of them.
So if it wasn't for people on the inside dropping a dime, CMS, it would take them years to find out, if ever, because they just don't have. I'm sure they don't have enough people to go and audit all these people.
Well, they use their work plan and from find some low hanging fruit that they can go in and get. But some of these bigger um cases or things that kind of are not on their radar, like you said, primarily comes from whistleblowers. And then it becomes low hanging fruit for others because then folks are scrambling like, wait a minute, let me make sure my ducks are in a row and I'm doing what I'm supposed to do. So yeah.
But I would love to know how we can get the update because I want to know what is going on with the University of Pittsburgh Medical Center because remember we had discussed them a few months ago where they were disputing the government's um, case, the government's findings. They were arguing over like certain diagnoses because they were saying that at they wanted to know. I think University of Pittsburgh wanted to know did the auditors that the government used did they have their CRC?
I remember that. I remember
Hmm.
that. Um, I can look back because they keep the reports and the information on their site, so we can go back. I'm not certain
On the
about the
University of
updates.
Pittsburgh?
No, on the OIG. So
Oh,
any
okay.
of those reports, when they send those reports out there, or when they send the information out, there's actually a report that details all of the things. Um, I'm trying to think though whether or not they update them regularly or how often. But I can go out and look. I'll send you something. If I find something, I'll send it to you.
Okay. So I go look still. You go to the OIG website.
Uh-huh. If you and
Okay.
easily if you know the number, the case number thing, you can easily pull it up. But you can always
Yeah.
do a Google search of the entity. Um and that'll come up too.
Okay.
Yeah. We always and that would be good to know because I do remember we talked about that
Mhm.
and they was all up in arms about that. Like,
Yeah.
hold up. Cause I was still thinking about putting together my whole HCC company. I don't have my CRC, but I know plenty of people who do.
There you
Um,
go.
and yeah, here we go. All right. And actually, I went out and looked, and they do have contracts, government contracts out there that you can bid for. So I said, oh, all right. It's not all about the things that you think, the pens and the pencils and the paper and those things. They're
Right.
actually, for real government services that they're looking for. And we are one of those
So
services. All right, y'all. That's your entrepreneurial tea for the day. All right.
there you go. So did it say size? Because if they had a small contract, like because you
They
usually
vary. They vary.
I'm gonna have to go check it out because that's something that's
Yes.
always been in the back of my mind. If I could,
Yes.
because if it was a small one, I could do it.
Yes.
Because I can do like it's nothing to do 100 HCC charts a week.
Yes. And the last time I looked, there was something um in Atlanta, something going on in Atlanta. It hadn't hit. It was on its way. Come on, Asha. They hadn't hit, but it was on its way to be made public for people to bid on. So yeah. And I don't remember what made me. I think it was running through my mind the different things that I wanted to do, and I was like, oh, I know what it was. We were talking about certification. Women-owned certification, and minority-owned certification, and I still haven't gotten the full answer to my question, because we have state certification and we have federal, and I'm like, are they the same? Does one trump the other? And I think, just based on what I've heard and what I've read, you actually need both. So if I want to do something with federal, I need to go and get federal certification. And if I want to do, they're not reciprocal. So if I want to do something with the state, then I need to go get the state, because the state will have things that are available that they need, that they are asking for folks to bid on. And then federal, there will be things to ask folks to bid on. So that's what I was looking at. And then when I went out there, like, well, let me see, would it be worth my while to do this? And sure enough, I saw where that was coming up for audits of records. It was in Atlanta. I want to say was it the Atlanta VA? It was something in Atlanta. It may have been the VA.
Okay.
I said, well, look at God, right here. It's right here. And then, of course, school happened and I didn't follow through. So that was on me. But yeah, that was the tea. Hey, Asha.
Okay, so y'all talking big talk for a little fish. But the one thing the little fish can do is count.
Ma'am, and ma'am.
So can you break that down to little fish language? Because I get the certification part, because I'm all the way there with what certifications I need to do what in what direction. But this whole government contract stuff is real juicy.
Right.
And so I think if you said, okay, look here, like you pointed, like, Jesse had just kind of schooled me last week. I'm still chewing on that Jesse PS and I inboxed you. So take a look. I meant to catch up with you, but this week has been real busy. How does one then look for government contracts in this industry? And then I guess if I have other questions after that, when I look, then I'll inbox you guys. But I find like, because we are where we are, it's not a lot of competition necessarily. Most people that I know that's been coding, they're not necessarily looking like this.
Mm-hmm.
So talk to me nicely.
Well, nicely, to my co-host's favorite word, the gatekeepers have been all over this and been doing this for years. It's just new to us.
Okay.
If you will.
That's right.
But I don't have my book in front of me. I don't have my book in front of me.
I don't need to answer now. No pressure.
However, there is a website that you go on. You have to be registered or linked. You don't even let me back up. You don't necessarily have to have your certification to even bid on these services. It helps you, because
that's what I'm noticing.
It helps you because it carves out additional opportunities. So there's like so many percent of, if you're doing business with the government, that entity has to state that they have so many percent women-owned businesses or minority-owned businesses or what have you that they're working with. So it kind of gives you a slight advantage in that pool, but there's still the larger pool of 80% that anybody who wants to bid on can bid on. So technically, you can be in kind of in both areas. I think you have to. I'll get my book. I'll have it for you. If I don't, I'll shoot it to you. I'll put it somewhere. Maybe I'll put it I'll send it to you directly. If you want it, get in touch, back channel me or something, and I can send it to you. But you go out there, you register. And so once you register, they'll automatically kind of send things to you that you are interested in, because you can do a search. And I think I just did auditing. I think I put auditing in the search, and lo and behold, I saw like all these, and it was not only, healthcare auditing, but it's other types of auditing that the government needs. But I zeroed in on that one from the, I think it was the Atlanta VA. I know it was in Atlanta, but I think it was the Atlanta VA, and it was something coming up, and it didn't seem like something that was like huge. I mean, but even in the huge ones, somebody who knows somebody who knows somebody. Y'all, we better get together and pull this together and let's go.
But like, so Asha, like to your point, like you have to you have to have a company, or you have to be legit.
Oh, definitely.
Like, right, you have to already have your business bank account. You already have to have your EIN number, your LLC or S corp, however you're going to have your business set up.
Yeah, that's
And
part
you
of the
have
registration. So
right,
yeah, all of that information will definitely be required in the
right, and
registration.
that's before you can even bid. Like you have to have it used to be a DUNS number, but they did away with that April 1st. Like some other kind of now you have to have a cage code or something like that. So that's the back end. And then once you have that information, then you're able to bid freely. And then you can also give yourself points by being like a minority owned company, a female led company. So there's things you can do to kind of help bolster your chances of approval for a government contract.
Yeah, we talked about this a while back.
Mm-hmm.
Yeah. Did that answer your question, Asha? You're muted. Okay. She's still muted.
Yep.
She may not be in the area where she could talk. Okay.
Okay.
Well, when you come back.
Oh, Natasha. She wants to come.
Oh, come on, Natasha.
All right.
Hi, good morning, everyone.
Good morning, Natasha.
Hi. So, guys, I'm Natasha, and I am a nurse. And so I just came across this room. I was like, billing and coding. I think that would be interesting. So let me stop in. And so I have a chronic care management business, and so I, am getting started with that. And so I noticed you were talking about behavioral health, and it's also one of the services I'll be offering to providers as well. And what I am noticing is like there are larger companies that are now hiring lay people to do the care management services, and I'm like, is CMS okay with that? I mean, I don't know. It's just so new to me, all of it. And, I just wondered about that. And if you guys had any, I don't know, feedback on chronic care management and, how it's going. I don't know.
So I actually have a client that is one of those lay people. And it's not, well, let me back up. So they're not doing any Medicare billing. Theirs is strictly for the state. So they're just doing Medicaid. But they allow these qualified mental health specialists or behavioral health specialists who, I mean, there are tiers of them. So like your first tier is you have to have a high school diploma. Your second tier is a bachelor's degree. A third tier is master's. And then you can have a tier that you don't need any degree. You just have to have at least 3 years of experience. And your employer has to vouch that you have that experience. So it's crazy. Because and I guess it depends on the individual. Let me just say that if the individual really knows their stuff and knows what they're doing and can provide those services, and the client that I have, she's been in this game for a while. She deals with children though, and youth, and so her part of her business is mentoring and providing services to underserved youth. And so this other piece of the business, now she's linked with a licensed independent social worker, who does the diagnosing, who does the assessments, who does all of those things. And then she tasks her on her treatment plan to do the follow-up and the case management and make sure that all the things that the social worker has placed in her treatment plan, make sure that they come to play, make sure they're following through. So that's what she primarily does, which she's not diagnosing anything. All of that stuff
Right.
comes from the social worker. She just running around, meeting with them and the parents, just to make sure, hey, you were supposed to, or there's you had a referral to go see so and so and so. Did that happen?
Right.
You were supposed to make sure that you reached out to your school counselor for XYZ. Did that happen? So she really just follows up and follows through with the treatment plan of the social worker. So I think, to me, they're just extensions of that social worker. But I believe, so that's one client. I got another client that does something similar as well. And they're relatively new in the behavioral health space. But there's some, she's in her feelings, and I don't blame her. She's in her feelings and she feels some kind of way because she's not 100% certain. She's coming into an organization and she doesn't have the confidence level about the staff. And so my recommendation to her was, this your license on the line. So you need to make sure that staff is competent to perform the services that you need them to do. So if you got to train them to make sure they're up to speed on what needs to happen, then you may need to take the time to do that. In order for you to feel confident and to put your license on the line. But like I said, that's what they're doing in the Medicaid space. Now, Medicare, I haven't run into any Medicare yet to see, how they're going, but they're paying it in Medicaid. Of course, you have to put the appropriate modifiers on there. There's only like 2 or 3 codes that they can actually bill for. So it's a very limited closed space.
Right.
They're not. Yeah. But it's working. So far it's working for them.
Yeah, because that was my concern. Like, because I'm in New York, and we can outsource the, like you're saying, the phone calls and just those follow-ups. And it's like, okay, well, I don't need a nurse for that. I'm already the nurse. I'm overseeing that. And, I have to do the care plan, of course, but, from state to state, if it's different with Medicare, because really you don't need a license to call someone and just say, hey, did you go to your appointment?
Correct.
Yeah.
Correct. And from a provider perspective, I mean, it decreases your overhead because, like you said, you don't necessarily have to pay an RN. You don't have to pay a nurse. You don't have to pay a specialized or licensed person to do those services.
But they're so resistant to it seems, just me approaching providers and stuff. It's like, how could you not want to offer this to your patients?
Right.
So
that's interesting.
So that's my goal, really, to kind of educate people about it and just get more people to utilize it.
Yeah.
So,
definitely.
But yeah, okay. Thanks for sharing that.
Well, thanks for stopping in. And if you have any other questions or want to connect, I followed you. I make sure you all follow the people in the room. Y'all know how we talk about that. We, definitely you never know who's in the room and what kind of contacts and connections you can make. So we can definitely. I'm curious to know, like New York's rules, how because every state does something totally different. It's
so
ridiculous.
Here in New York, I can utilize medical assistance. I contract to providers to set up CCM or RPM, behavioral health, all of that in their practice. Or like they would contract with me, and I have specific, amounts that I would charge per code and or bill per code. And so then I would provide the services, send him an invoice, and then once he gets paid, he would reimburse me for the services. So that's kind of how it works here. And so I also, try to teach other nurses how to get into it, especially minority nurses, because it's our communities that are suffering the most with chronic conditions. And
Exactly.
so my goal is to just try to empower some nurses, minority nurses, to get into it and do it, because it's something that we all do as nurses. And I think patients want to see people that look like them.
Exactly.
So that's what I'm working on now. And so that's why I was like, this would be a good room to stop in, because coding and billing and stuff is not something that us nurses really even pay much attention to. I know a bit about it because I started as a medical insurance biller in a medical practice. So,
Okay.
I know a little bit,
Okay.
but
Okay.
yeah, but you guys share a lot of good information. So thanks.
Well, appreciate you, and bring a friend next time. Bring a friend.
I will. I'm inviting all of my other partners that also teach the chronic care management as well. I'm inviting all of them.
Cool. I appreciate that. Mr. Jesse, did you want to chime in?
No, I agree. I only had Medicaid experience on the state level with mental health too, not Medicare.
Mm-hmm. But it's coming. It's opening up too. So especially even with substance use disorder, when they opened that up, Lord, the floodgates opened up, because it was crazy to me. Like, so once a person becomes 65, then they're no longer eligible for services, and like, but they still need services. The addiction didn't go away. The stuff is still happening. What happens? And so I was glad that Medicare stepped up and began offering services and paying for services for our elderly, because there's still some challenges there. There's still some
there are. And so Medicare is, is paying more this year. So they're really kind of pushing that, initiative to get people and doctors to use it. So
yep. There's another opportunity. Look at the tea that's being spilled today.
And then also, along this, it's kind of along the same vein, and that would be something that maybe Natasha, you could look into, because I was reading last night, because in every crisis there's an opportunity.
Amen.
And
Amen.
Everybody is all up in arms about the Roe v. Wade decision, and I read on this thread that a possible business that could stem from this could be sex education classes.
Okay.
And if you think about it, like, because there are 13 states that are automatically going to trigger no abortions. So those 13 states, most nurses now have a compact license, so you'll be able to provide services in those states. You could partner with a group with even there's be some kind of way you could do it to partner to even do virtual. I'm sure you could do virtual classes. So, I mean, I don't have it all worked out, but I'm just thinking from an opportunity standpoint, there would be a way for people to kind of make some money even from that.
Look at you in the middle of the night working in your brain on a Roe v. Wade. Yeah, I hadn't had that on the docket, but you're right. There's always opportunity in this case, foolishness. But having my public health and legal class last semester that I got my A in, you better do it, girl.
Congrats.
I'm moving to this semester is public health, law, and ethics. So we stepping it up a bit. But I understood. I'm not happy with the decision, but I understood the decision from the Supreme Court perspective, because it's nothing constitutional. It's at the state level, and it should have stayed at the state level. And so I get it, but it's a mess because it's just a mess. And what some of these states are doing is just horrible. My child lives in Texas, and she's pro Texas, and only because she just likes the weather. I think that's why she loves Texas. But I was like, girl, the laws and rules in Texas, ma'am, you better understand what's happening in your state. And And in Ohio, I think something triggered for us. And so it popped up last night where our governor signed a bill that was something that happened, I think in 2016. And this opened the floodgates for it to come back up. And I think he signed it. So I think we probably in that number. Probably in that number too. It's a mess. But like you said, there are opportunities in that mess that we can definitely help and assist. So cool. Well, again, thank you, Natasha. Appreciate you. Yay. Okay, so here is the tea spiller for the day. You want to cue this one up, Mr. Jesse?
Oh my God, this one.
This is what we were going to talk about last week, and I didn't see
Yes.
the email, but I said, "Oh yeah, because we're gonna need some time on this." But go ahead.
There was an article by 3M is the company that has developed the encoder, the 3M encoder that everybody uses in inpatient to calculate MSDRGs and APR-DRGs, and they're involved in a lot of coding activities.
Mm-hmm.
And that they provide a lot of coding support to outpatient and inpatient facilities.
Mm-hmm.
So they have an executive, Nathan Carver, who did an article last month, and they talked about the future of medical coding.
Mm-hmm.
And basically the future is automation. And it was an interesting article because there were a few takeaways that I wasn't, they're audacious in their plans, but they don't have a very clear way of how to get there,
Mm-hmm.
in my opinion. And just from a practical standpoint, I think is on a very highbrow level, I get it, but in the day to day, I don't know how they're going to execute it.
Yeah, and if you're on YouTube and Facebook, I did put the link in the description. It should already be there. So if you want to open up the article, if you're following, you can definitely do that.
Because what I was shocked about was what shocked me most. I didn't even know that medical coders, it was considered a healthcare emergency because they don't have enough staff. I mean, nobody ever talks about that. I was shocked about that.
Well, they've been looking, and I mean, they're always talking about they don't have enough qualified staff for coding, but yeah. So the thing that got me, and we've been talking about this, we've been saying this, that with the automation, it's designed right now in somebody's mind to kind of take off some of those real easy codes. I'm thinking the first thing I thought was like even in the emergency department, you pretty much, those simple tasks, those simple codes that, don't require a lot of a coder's knowledge and expertise. Supposedly freeing up the space for coders to get those more complex cases. But then they talked about auditing and data validation. And we've talked about that over and over again as the next step to your career ladder, if you will. So, and data validation to me is just it's auditing too, because you're just making sure that data is supported by the documentation. Auditing, you go a little more deeper, but data validation, same kind of concept. And so again, that's not going away. If you are specializing, particularly if you are specializing in a particular area in coding, you are already building and setting yourself up to be the expert in that area, to then come behind and say, wait a minute, I've seen these cases. I've seen enough of these cases to know what is necessary, what should be there, what the documentation should look like. Flip that and say, let me check to see that this stuff is here and go forward. So even as the future unfolds, I'm thinking about our robot. There may be some our robots sitting somewhere doing our duty for those one things. Again, there still has to be a coding professional in the front of that, because they got to program it. They got to know what those rules are, those regulations, all of those things. We know our rules and regs change on a drop of a dime. What happened in COVID was just no short of a miracle. It felt like every week there were new codes, there were new regulations, there was new guidance, there was new something. I mean, it was just like boom, boom, boom. And you had to stay on top of it. Otherwise, you may not have gotten reimbursed. You may have been coding incorrectly. There was a lot of rework probably still happening as a result of that, if you weren't up on those changes. So there's still a need for the human interaction, the human intervention, the human involvement with our profession. So don't ever think that that's going away. Don't be afraid of the computer, because you got to tell the computer what it is and it needs to do. And you got to check to make sure that the computer is doing what it needs to do. Both of those entities require that human brain that we have. So come on 3M with whatever you got going on. We just know to be prepared, and prepare yourself for what that pivot is going to look like.
Now, this is the paragraph that made me cringe a little. It says, in ambulatory settings where there aren't coders on site, providers rely on pick lists, manual reference guides, or memory to assign codes.
Oh.
This approach is inefficient and is prone to errors and denials. In this setting today, 3M helps providers review codes and compare them to what our system would suggest. Using a rules-based approach, codes that pass the threshold can then be sent directly to the billing system without coder intervention. I don't think anything should ever go to the billing system without coder intervention.
You will be surprised.
I'm sure I will, but
surprised, because primarily because of those was it a 3-day drop, 3-day bill drop. So you got to have those bills dropped in 3 days. It's probably quicker on an ambulatory side. You don't need 3 days to review that. So it's quicker on that. So that stuff is going out that night. As long as it's, well, because some things aren't even signed. That's a whole other thing that just, my spirit. The compliance part of it is like, sign your stuff. You can wait until they sign it, so it's all good. Because what if they don't come back and sign it? Then it's flagged for review. It's audited. It's a wash, because you can't come back and be like, oh wait, let me add it. No, it's done. It doesn't exist. Sorry. Because
where I worked, what they would do is if there was if there was something wrong, you would put a hold on it.
Mm-hmm.
So it would take it out of the system. Then you have to go in and manually release the hold once it was fixed for it to go into processing. But you're right, like otherwise it just goes straight through.
It goes straight through.
And it doesn't, and you're right, it doesn't take 3 days. Mm-mm. It's like automatic.
Mm-hmm. Mm-hmm. So the scary part,
they have bots now, even on the third-party level, that run it regularly, daily, 2 and 3 times a day. It's an electronic bot that's how it's programmed to run it, to do everything a human is supposed to do. And if the human doesn't step in, then it won't do it. So on the private level, it's almost seamless between the bot and the humans. But I just interviewed for a state hospital. They still working on paper, and I don't understand that. But some of that stuff hasn't even been scanned in since COVID.
Paper.
They're back on just like Xerox. Yeah. And they don't even really want to understand. I don't know. Part of me, I'm like, do you understand that you could just train somebody and you would want to do that because they have coders? Most of their coders are like 5 years near retirement. Or they're really looking at, well, can we just get a clerical assistant? I forgot what they call it, medical records assistant, which is still dumb, but it's paper, and they have stacks of paper, of records, of notes, of whatever that need to be scanned in somehow to whatever system they're using. But it's a state hospital here on Long Island, and I was confused. I was completely baffled, but that's what their solution. That's their system. Wow. And no, they weren't looking for it differently. And even that position was supposed to be a state position, so you have to take the test. For that senior position, they opened it up, talking about gatekeepers for one person, and they knew who the person was, so the person could take the test to fill the position. And for every other lower or lesser than position, anybody out in the world like myself who would have been eligible for that because we have the experience, it wasn't made public. It was only made as a promotional thing. So I realized even internally, politically, there are people within these spaces that are only opening up positions and keeping the system to themselves in their own positions. It's really not about the medical, the billing, the money. They don't care.
That's right. That's right. And
That is 100% true. That is so true. I experienced the same thing. I've seen that. Yeah.
That's crazy.
They just keep, rotating the same people, or, not utilizing people that actually have the skills and knowledge.
And they told me during my interview that they had stacks of applications, so they opened this one wide up. And by far, I was the most experienced. And ask me now if they hired me, and that's on the state level. So they didn't hire me, but Northwell, which is a private hospital, picked me up right off the rip. But the state hospital that is desperate, that is like it's a skeleton crew who needs it. In the matter of fact, they needed help even on the state prison level because the hospital is connected to the local prison system in Nassau County, and they're desperate. So imagine the treatment and the record keeping on that level. They said they haven't had anybody in that position for over 5 years.
Oh my
so they
God.
were doing like a $5,000 or $8,000 bonus. And even with that, they still didn't call me because I was looking at her. I said, I count money, so I wasn't worried about it. As long as I'm not wearing orange or black and white, I should be fine. It's automatic. Automatic $8,000 off the rip. That's okay with me. I'm gonna figure it out. It doesn't take my benefits or the money away, but again, they're looking for who they're looking for, and the gatekeeper does not look like me, and she's not gonna, it's just obvious what they're not looking for.
That is crazy. There has to be a way to figure out how to circumvent. And you know me, we gonna keep knocking till we get the yes. I don't know how to. You gonna make me think about how
you don't think it looks like that on that end, but I was in awe.
You're in Long Island, right?
Of the department.
Yeah.
Yes,
and like you're in Long Island, so like I know, in Long Island, like I know that there are businesses that have to put white faces on, but it's black owned. I mean, I'm like, daycare and stuff. I'm like, that is crazy.
And all the billing companies are of a certain demographic, and most of the people that are hiring do not have certifications. They've just been doing it for 6, 7 to 10 or more years and better, and so they're working for a private agency. Like you said, I forgot who was talking. A lot of them don't have the certification. They don't have the background. They just have the in-house training. And they are, I think one of the companies I worked for is now into, ironically, we were just talking about behavioral health. They are now doing in-home nurse care. And they're hiring like crazy. They must get money from the government because I think they were offering, I think, $5,000 bonuses. And if you stayed, they'd give you X amount more. And if you referred someone, they were giving you X amount more if they stayed 6 months or more. So they're not playing in New York, at least. I'm like, money came from somewhere, and I didn't get the memo. But they got the memo.
And that just goes to show you there is money out there to be made. It's just trying to figure out, how to circumvent some of these gatekeepers, because they're not willing to give up what they already then had and have had for years. They're not willing to give that up, but they understand that folks we're a little crafty. We still here for a reason, and we're continuing to knock those gates over and move those gatekeepers out of the way. I hate that, but I get it because you got to play the game. Somebody told me a long time ago, all of this is a big game, and you just have to know how to play that game. She told me that a long time ago, and that has stuck with me forever in everything that I do. And if playing that game means I got to partner with my Karen over here, come on, Karen. Come on, Karen. We'll put you could be the face of if need be for this particular client, and I could be the face of for this particular client. But yeah, that's crazy.
Yeah, yep, sure. I'll definitely work together.
Definitely. Oh my goodness. But you would think State Hospital had this need. They haven't had somebody in 5 years. Can you imagine the mess that somebody is about to walk into? Whoever gets into that position, that's horrible. But then they go ahead, Mr. Jesse. I see you breathing.
They should just be glad they have somebody that wants to work with some daggone paper charts. Let's just start right there.
Well, she said paper. I'm like, paper.
Yeah, that's what I said. I was like, how they moving prisoners and inmates, and they got paid. But then it made sense when I went into the hospital and you see them, because they didn't always use the tunnel. They walked them straight through the halls like regular people in shackles. But the guards would be carrying the papers, and they would have the inmates carry their own paper charts. But that's I came in with paper, so I kind of know how to organize, and I know how to make it electronic. So to me, you teach me, I'm like, I'm in there. But like I said, it's been 3 weeks, and they did not. I've already started a whole nother position.
I mean, paper charts is not, to me, it's not that it. The reason why I don't like paper charts is because the first thing I go to is handwriting. You can't read everybody's handwriting. So that's when you're trying to code, that's a problem. So I get, I scan it is easy, following it is easy, but when you have to sit there and try to figure out what it means, and then somebody has increased up arrow and HLD as a diagnosis, that's not a diagnosis. You can't code that. Those little things.
Yeah, that's what we used to do back in the day.
Yeah, I remember doing that too.
That's what you used to do. That's all you had.
That's all.
And prayerfully there are no productivity standards over there, because definitely it's gonna take a minute to go through some paper and decipher somebody's the legibility of these records. So yeah.
Well, that, and then coming in the door, they made it clear that overtime was not necessarily expected, but appreciated. And so I was like, you going to give me about how many $1,000 is a plus? And you're going to give me overtime out the gate? Girl, bye. I was already in my head. I was like, I could do this. I could do this for about a year. I could do this. I could suck it up. I got goals. I got things I'm trying to do.
Exactly.
So I thought with them being in need, they would absolutely. I'm like, I'm going to hear from her tomorrow. Not even.
But the state moves slowly though. They have no sense of urgency about anything.
5 years, they haven't had somebody in a position for 5 years, clearly.
Yes and no. If they make it where you don't have to take the exam, and they're like, okay, we're desperate, we're going to hire without the exam, and we'll just make it that you could take the exam later. And on Nassau County, if you know anything about Nassau County, they can make it happen. The fact that they didn't, it's because they're picking and choosing who they want and what that person looks like in the background. And she straight told me, like, I was probably the most experienced, so it's who she wants.
So you had a conversation with them about, so you got the no and had the conversation about it.
I had about a 2-hour interview.
So, I mean, after the fact, after they decided to go in a quote unquote different direction, you've had a conversation. Did you have a follow-up conversation with her to find out what?
No, actually I didn't even bother, because the hospital called me. So I wasn't even going to bother with it. I figured if they call, they call. If they don't, they don't. But it also just showed me how gray it is based on my conversation with her. If you didn't call me after everything you said, then you needed to hire based on how many applicants she got. She was siphoning it down to at least 10 to 20 interviews. She needed at least 10 of them in any capacity to train, because they had nothing. They had nothing. So I don't know how you tell me that one thing and you do another. And even still, if you're that kind of person that says one thing and does another, I'm not even too sure I want to work with you. So I would have definitely went to the prison. You don't need to be in your direct, because I'm not going to learn anything from you. You're not honest.
I get that. For me, it would have been an additional step. It would have been a learning opportunity for me, because I want to know. I want to have that conversation. I want you to
go
tell
back
me.
and talk to the person.
Yes, ma'am. I want to know. Tell me if there was something that I may need to improve on. If there's something that specifically that you're looking for, what was the disconnect? Because clearly I come through the door qualified for XYZ. What is it? I would want to have that conversation. That would just be me, just as a follow-up. Like, hey, I appreciate blah, 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 but can you give me some, tell me whatever. And then if I need to get my sister to come in the door, she armed with whatever it was that I didn't have when I did mine.
That's true. And I guess I could actually do that. The other funny part was, I think, so we have Nassau and Suffolk County out on Long Island. In Suffolk, they'll hire you straight from the department, if with or without the test, provisional. And then when the test comes, they'll make you permanent. Or if you get like transferred into another listed role once you're in the hospital system. In Nassau, what she was telling me is she could select somebody, but it still goes to the state level or that county level where you would have to apply like on a paper application again. And then they actually are very, I can't think of the word, but they're very strict about what you write in the application based on what they have put in is your requirement. So she might say, yeah, I want to choose you, send your resume for them to call you. And based on what they think of your resume or they think of how you fill out the application, they might say you don't have enough hours according to what they've determined are the prerequisites for this position. So I was like, this just sounds like a whole lot of
It's a lot. So you got to have those buzzwords. You got to have or those key phrases and key words in order to satisfy whatever it is that they're looking for. And even though they're doing it on paper, they do it even on a bigger scale electronically, because it'll kick your stuff straight out. If it's not matching what they've already put in their system is what they need for a particular position, it'll kick you out straight out. And you could have a gazillion years of experience and all of that, but if you are not meeting, and that's why even with, that's a whole other conversation. Resume writing, you have to tailor. Long gone are the days I got a blanket resume that I'm sending to everybody. That doesn't work anymore. You have to tailor your resume for each position that you are applying for, because there are certain things that they want to see. And if they're not seeing it, your stuff gets automatically kicked out. It's a lot of work. It's crazy and foolishness, but it is what it is in today's time. You millennials and Gen Xers and Ys, look what y'all done did. No, I'm kidding. But yeah, it's crazy. But yeah, I would definitely, for me, I would follow up just to get some understanding and appreciation of what it is. Because she may spill a little tea. Let her talk. Mr. Jesse,
I will.
You got anything to add?
I have done that, and at the end of the day, you still know what it is.
I mean, you know what it is. I get it. But I want to hear you say it. We all know what it is. I want to hear you say or tap dance around it or whatever. I want validation. The compliance person in me. I need validation. I need to know. I don't want that gut feeling. I don't want to think. I want validation.
Okay, so for me, right, on Monday, I'm having a Clubhouse on this exact topic, racism in healthcare, or just, how nurses I don't know if you're a nurse, but how we experience racism, subtle or, not so subtle, at times in the healthcare field. So I think it's totally based on race. Has nothing to do with your qualifications. You have exactly what you need, and it's your race. That's it. And even if you call, and of course they may give you some BS, but we know that's what it is. And that's a lot, that I see as well when I go into certain practices. I know you're telling me no, because of my race, because I have all of the experience, I have the knowledge, I have everything right here to really help you, you know, but what's the barrier? You can't tell me it's anything but race. That's just how I feel on that.
Well, I mean, but that is a given in America, period. Like that's as sure as saying today's Saturday. It's a
Yeah,
given.
yeah, it
You're
is.
never going to get away from it. And I think that collectively the answer for black people is
Mm-hmm.
that is ownership. We have got to start owning businesses.
Yes.
Right. Yeah,
Period. Point
exactly.
blank, period.
Exactly.
That's right.
You are so
Because then
right.
that way
Right.
we can hire our own.
Create our own
Mhm.
opportunities.
Yeah,
Exactly.
exactly.
And
Yeah.
that is the only way out of this, because as long as they can maintain an advantage and
Right.
and have the power to say yes and no, it's going to
Mm-hmm.
happen. That's
It
just,
is.
I mean, I can share, like, even with me, the coding nurse.
Mm-hmm.
I have
Right.
all of my information. I have a
Mm-hmm.
website. I have a YouTube channel. I have Instagram. I make it
Right.
very clear what I offer,
Mm-hmm.
and I even have payment arrangements. Every time it doesn't fail, I always have a class where somebody who does not like this, not like this,
Mm-hmm.
when it
Right.
comes time to get up off the money, then they have all
Mm-hmm.
these kind of questions. Well,
Right.
can you guarantee? I'm like, wait a minute.
Right.
What education have you been to where they've guaranteed you anything?
Mm-hmm.
When you went to nursing school, your nursing school didn't guarantee you a job.
Right. Anything. Yeah.
They said you'd be eligible to take the exam.
Mm-hmm.
When you complete my course, you'll be eligible to take the exam. Now, would I help you? Would I give you tips to get a job? Absolutely. But guaranteed, no. Nobody else gives you a guarantee. And then that's
Right.
and see me, I'm from Philly. We call a thing a thing. I put it out there. And I'm
Mm-hmm.
like, listen, if you're not comfortable spending your money with me, go spend it with somebody else.
Right. Right.
It's just and I dismiss it. Go
Mm-hmm.
ahead. Because the bottom line is I know.
Yeah.
I know I got my sugar honey iced tea on point.
Right. Exactly.
Ain't nobody out here spitting game on coding like I am. Period. So
Right.
you go ahead and to AAPC and spend your $3,000 and then come to me and pay me $40 an
Mm-hmm.
hour to tutor you when you fail your exam.
That whole part.
Yes.
That is the.
I beg to differ, though. I'm out here spitting. Like, let me stop.
Okay, all right.
You stay in your inpatient lane. I got the physician game on lock. Don't play with me.
But no, when I say that, I mean
I'm messing with
right,
you.
right.
You know I'm joking.
It's
I'm
mainly
messing.
nurses. Look,
Right.
because the thing is,
Mm-hmm.
it's just a given. It's just a given.
Yes, it is. It is.
It is.
That's why, I mean, it took me. I still don't have even on LinkedIn. I don't have my picture
Right.
because
Right.
because I've seen it has
Mm.
happened too many times in my life. Like, people
Yeah.
want to act like it's not a thing, but it's real. I'm
It
going
is.
back to when I got in IT. First of all, like, I have a very odd last name for a black person, Gallup. We're the only people I know that are black to have. Every other Gallup I've met has been white in my
Right.
life.
Mm-hmm.
I got my IT certification. This man, because this is back when Monster was first popping,
Mm-hmm.
this man sent me an email and a voicemail telling me that he had seen my resume and he has all kind of opportunities available for me to just
Mm-hmm.
contact him. When I contacted that man and Jesse started talking, and he could tell that Jesse
Right.
was from a certain demographic, and
Mm-hmm.
that if that man returned my call, so did the Pope. So what happened to the opportunity? I'm the same
Right.
person.
Yeah. Exactly. You are the same person.
But you just have to, but that is just a given, being black in America. I don't let it stop.
Yeah.
You can't let it stop you.
Exactly.
It is, and the thing about it is, like, with my course that I came out with, there's only one other, person that I know of doing it. That's white. And, people, go and flock to her. And then when I offer so much more value, they questioning, whether it's going to work, whether, I'm like, come on, really? I know, as a black nurse, I put, like, I have to give so much more. I've had to give so much more and, you know, prove myself so much more, you know, and so it's something, you know, I think we really do talk about more. And so I, you know, hope to start doing that, you know, because it's a lot of times, you know, we don't talk about it, you know, as
Right.
openly. And it's, yeah.
Right, but talk about it to what end?
Yeah.
Because at the
Yeah,
end of the day,
exactly.
You know,
if
for me, right, talk about it to what end is for me, I would say to encourage nurses to actually do something for themselves, to actually start that business, to
okay,
actually be the ones providing the care and
got
not
it.
allowing large, you know, companies to take over this space that we, you know, can have such an impact on.
Yep.
Got it.
Yep.
Yeah.
Okay.
Yep.
Because one thing about it, and we that's what I see lacking nowadays. There was a time, you know, and I'm of a certain age and I'm of a certain era. There was a time when blackness meant something, and it came with a certain strength. It came with a certain confidence. It came with a certain sense of self. Now I don't see that. I see people who are very educated,
Mhm.
book wise,
Yeah.
but they don't have any mental toughness. They don't know how to mesh the two because because they're almost like it's not almost, they weren't prepared to deal with racism because some kind of way it's like they almost think, well, I've accomplished this, so I'm on their level. You will never be
Right.
on their level. They will
Right.
never
Never.
see you.
Never.
So and it's not even a thing of you should feel bad about it. It's just you have to know that that's what you have to. That's the mindset you have to have going out there and going to get something. And you have to be
Mhm.
like, I'm going to get here regardless. If I
Yeah.
have to go
Right.
through 17 people, that's what I'm going to do.
I'm
I'm going to
kicking
go
until I
through
get that
17
yes.
people.
That's right. And it's a
Yes.
it's a confidence level
Right.
that we're confident in our knowledge. We're confident in what we
Right.
have, but then for some reason we become timid when sitting at that table. When
Right.
when
Yeah.
when explaining the information that or the knowledge that we have, because we 8 times, maybe 9 times out of 10, we're probably the most knowledgeable person at the table because
Mhm.
we have to do more to prove, to show, to be. So
Yes.
it's like bring that boldness everywhere you go. Bring that boldness when you walk into that interview. Bring that boldness when you're putting together that business plan for that business that you're gonna start and you're gonna hire everybody else. Bring that boldness in every aspect of your life. Don't let anybody. The one thing I know about education, it is the great equalizer. Can't nobody take that from you
Right.
at all. No one can take your education from you. Get it. Get it all. Because at the end of
Yeah.
the day, again, they can't take that. You can't refute the knowledge. Can't refute the knowledge. And then
Mhm.
you know me, you show them this other side. Oh, well, if it's not for you, maybe it's for you. And then I can create what I need to show and be whatever it is for somebody else. And I'm sorry,
Right.
you missed that opportunity. You missed it. You could have had it. You missed it.
Mhm.
But that propels me even more. Like, oh, okay, is this what we doing? Like I said, every time I see something, I'm reading something, I'm like, oh, this is the new game. Okay. Then it's time to step my game up.
Right.
And that's how I found this room. That
Yes.
I don't know how many more interviews I had to go on, how many people I had to talk to, and I was like, this is
Right.
looking real scary. There's got to be something else out here than what I'm seeing. So
Yeah.
absolutely, toot toot.
Yay.
Yes.
Yes, it's amazing. And to Mr. Jesse's point, you know, this is not taught. This is not taught. This how to navigate this strange fruit is not taught. It's not taught.
And that's the part. Like that's why I think when I talk to you guys and I get on and I'll have my questions for but I feel like the one big question for the week because you don't know Like I said, if you point me in the right direction, I'll research it myself. I'll come back with some questions because I can't tell you how many times I've opened my mouth in the industry and I realize I struck a chord, but I don't realize how. I don't see the vibration on the other end. They're not going to tell you, that you're overqualified. They're not going to tell, they're not. They're just simply not. I remember when the lady said to me last Friday, she said, "Oh wow, it's so great that you did all of this." But the way she said thank you, it was like you did too much.
Right.
It was more like like the other side of the tongue lashed me, like, who told you that you should do all of this? And I'm thinking to myself, you came to me.
Exactly.
And asked me for something and thought I wasn't going to do 100 or 210%. Like, you didn't know who I was. I was like, oh.
Exactly.
Then when I got on the phone and Jesse got on me, I was like, yeah, I kind of figured that out now. Ouch.
Yep.
No, but that's how I felt coming out of school. Like, I am not going to find anybody like me, or there's not a lot of us who are willing to build our own brands and make sure that somebody else doesn't have to go through what I'm going through. It should not be this hard. If you really want to do something like this, it should not be hard. And not everybody wants to own a business. Some people just want to teach. Some people just want to code. Some people just want to build. But what you have to go through, I got a gatekeeper that looks like me for my other job that's holding up my unemployment. How about that? Because she's trying to hold on to her job.
Oh my God.
So that's what we doing.
Yeah.
That's what we doing in these streets.
That is.
And that's really, really gangster to me. But I'm like, you know what? God's gonna rock your world one way or another because my money is gonna come back 1000.
Right.
You stay there, keep playing. Stay here, keep playing with God's girl. It ain't gonna work that easy for you.
That's right.
So it's just more to me.
And that's
really crazy out there.
And crazy enough, that's another conversation. That's a whole other conversation.
It is because you know how much, I'm not saying, but like the questions like I get for like, purchasing my course. Well, can I, the payment plans, and we've adjusted this and we've adjusted this and we've adjusted this, to accommodate, what you're asking for, but yet you go and pay this other group without even questioning, and you're paying more than you would pay, my company, and I'm Black owned and I'm a Black female like you. And I'm telling you, hey, I know really what you need because I've done this. I'm doing this, and we can support you. But you question me more than you would question, someone else.
Exactly.
And yeah, so that is something we deal with.
And I tell folks all the time, I may not be for you because my price is my price.
Yeah.
I may not be for you.
That's where I'm at now.
I'm sorry, but
that's where I'm at now. I'm like, it is what it is. Don't want it. When you're ready, I'm here.
I know the quality and the value that I bring.
Yes.
And you're going to pay for this quality and this value if you want to get where you need to be.
Yeah.
And if you, and I do offer a payment plan. I got a payment plan.
Right. Yeah.
Outside of that, that's all I got for you. And I'm sorry, this may not be for you. You may want to continue to search so you can get that discount or that hookup or that whatever it is that you're looking for to get what you know. And prayerfully, I wish you well in your endeavor. 9 times out of 10, they call you back. Like, well, I spent the money over here, but I don't even know what they talking about. I ain't got a clue. And so
but you want my contracts, but you spent the money over there.
That's right. Now they coming to you for your assistance and your knowledge. I'm gonna charge you double now. So you had an opportunity, you missed it, and now you're coming back. I got you now. I got you.
Would you call that a consultant fee? Isn't that a little bit more expensive than a trainer?
Ma'am.
Yeah, I think that's what
ma'am.
Yes.
This is what happened to me. After you have somebody who takes your course and pays for it, and they tell you after they took the course, you don't charge enough.
Yeah.
That's a whole moment, huh, Jeff?
That is for what you provide and the information that you give. That's what's up. Well, this was a good day. This was good. Mr. Jesse, do you have any closing thoughts for the day?
I just am. I enjoy every Saturday. Like I say it all the time because I'm so glad that you created this space, Clarice, because it's needed, and we need more people. We need more Ashas. We need more Natashas each week, so we can really do some damage and really make some inroads and make some connections and just do the daggone thing because it's as out there.
Yeah.
And all we have are each other at the end of the day,
Yeah.
whether we realize it or not.
Mhm.
I agree. I agree.
So I certainly have some members I'll be inviting. You know, I have even another a pharmacist, you know, reached out to me about the same thing, us collaborating as allied health entrepreneurs, just Black, you know, or whoever, just, you know, that we're in business and we're doing different things in the healthcare industry, you know, and we can just talk about it. And, you know, Jesse, I'll invite you guys to one of the rooms because, you know, I think it would be great to have you guys.
Appreciate it. Thank you.
Mhm.
Cool, cool. Well, thank you all again for joining the Saturday morning tea. You know my question. Was the tea spilled today?
It was spilled, mopped
It
up, and spilled
overflowed,
again.
right?
Yes.
I think I got tea running down everywhere. So if this
Mhm.
information was valuable for you, help us share this message with others by liking the video, sharing the video, and subscribing to the channel. You can find us on YouTube at the Professional Reimbursement Network. You can also check out the Coding Nurse channel on YouTube. Mr. Jesse got gems over there as well. So check him out and subscribe to his channel. Yes, Vicky, the tea was spilled. I love it. I love it. Um, for those of you in the Clubhouse, don't forget to hit on the little green house to join in the fun in our club, and you will get notified of our live broadcast. You know, we are here every Saturday morning at 9 a.m. Eastern Standard Time. As I always say, there is um, knowledge and information right here in the room. Connect with each other, network with each other. You never know who is here, who can assist and help in whatever questions or concerns or areas that you need assistance with. So network with each other, and you know, when you, especially in Clubhouse, if you network with somebody and they in another room about talking about something, and it'll pop up and you be like, well, wait a minute, let me see what's happening over here. Let me look and see, you know, that's how we get the information. That's how we get the knowledge. That's how we stay connected. So stay connected with one another. Again, this has been a great session today. Thank you all so much for joining us. I hope to see you again next week. Again, bring a friend, bring a friend. Remember, be safe, be kind, and don't wish for it, work for it. Until next Saturday, take care, and I'll talk to you soon. Bye-bye.
Bye bye, everybody.